Salinas, often celebrated as the salad bowl of the world for its thriving agricultural industry, faces a deepening crisis of homelessness. Amid its fields of prosperity, over 1,200 individuals experience homelessness every night, according to recent reports. This crisis has steadily grown, highlighting the pressing need for effective social policies and community support systems. Despite the city's economic contributions and hardworking population, many struggle with basic necessities, raising questions about resource allocation and long-term solutions. Salinas stands at a crossroads, balancing its agricultural success with the responsibility of addressing this urgent humanitarian issue. One, the homelessness crisis in Salinas, a deeper look. Salinas, California, known for its agricultural abundance and scenic beauty, has a hidden crisis that casts a shadow over its picturesque landscapes. Homelessness in Salinas has reached alarming levels, with thousands of individuals struggling to find shelter, food, and security. This crisis not only reveals the city's vulnerabilities but also serves as a call to action for communities everywhere. Before we move forward, don't forget to like, comment, and subscribe to World Travel. Your support allows us to continue creating meaningful content that combines travel, storytelling, and advocacy. Have you experienced a city grappling with a similar issue? Let us know in the comments below. 2. Understanding homelessness in Salinas. Homelessness in Salinas is more than just a statistic. It's a deeply rooted issue reflecting systemic inequalities in housing, healthcare, and economic opportunity. With approximately 61.7 homeless individuals per 10,000 residents, Salinas has one of the highest homelessness rates in the United States. A recent Monterey County homeless census showed that homelessness in Salinas has grown by 12% over the past 3 years, affecting over 1,200 individuals. The homeless population in Salinas includes a wide demographic: families, veterans, single adults, and children. Alarmingly, 25% of this population are children under the age of 18, highlighting the devastating generational impact of the crisis. Veterans, who account for 10% of the homeless, face unique challenges such as post-traumatic stress disorder, PTSD, and reintegration difficulties. Mental health struggles are prevalent, with 34% of homeless individuals reporting conditions like depression and anxiety. Furthermore, 27% are battling substance abuse, creating a vicious cycle of instability that is hard to break. Housing affordability is one of the crisis's most significant drivers. The median rent in Salinas has skyrocketed to over $2,200 per month, pricing out many low-income families and workers. Over 50% of renters in Monterey County spend more than 30% of their income on housing, a threshold defined as cost burdened by the U.S. Department of Housing and Urban Development. For farm workers and service industry employees earning less than $20,000 annually, this disparity is particularly severe. Compounding these issues is a shortage of shelters and affordable housing units. Nearly 50% of the homeless population in Salinas lack regular access to shelters, forcing many to live in vehicles, encampments, or on the streets. Temporary shelters are often at capacity, leaving hundreds without a safe place to sleep. These living conditions exacerbate health risks and create additional barriers to stability, such as difficulty accessing employment or education. This crisis raises urgent questions about the city's priorities and the effectiveness of current intervention programs. Addressing homelessness in Salinas requires not only immediate relief measures but also long-term solutions, including affordable housing development, expanded mental health services, and economic reforms to create more stable and equitable opportunities for residents. Without these systemic changes, the crisis will continue to grow, impacting individuals and the broader community alike. The intersection of homelessness and substance abuse. The intersection of homelessness. Homelessness in Salinas is a complex crisis shaped by economic disparity, inadequate resources, and social instability. Salinas, known as the salad bowl of the world, contrasts its agricultural prosperity with a growing homeless population. According to the 2023 Monterey County Homeless Census, the number of unhoused individuals has risen by 12% over the past 3 years, totaling over 1,200 people. Of these, nearly 300 are children under 18, and veterans account for 15%, highlighting the diverse faces of homelessness. Families often struggle as rising rents, averaging $2,200 per month, outpace wages, particularly in agricultural and service industries. Mental health issues also play a role, with 38% of homeless individuals in Salinas reporting untreated conditions such as depression or PTSD. The systemic lack of affordable housing and accessible healthcare compounds the crisis, forcing many to rely on temporary shelters or live in encampments, creating long-term instability for the community. Substance abuse. Substance abuse remains a critical factor in the homelessness crisis in Salinas, both as a cause and an effect. Methamphetamine use is particularly prevalent, accounting for 42% of drug-related incidents reported among the homeless population. A 2023 California Department of Public Health survey found that 47% of homeless individuals in Salinas struggle with addiction, compared to a national average of 35%. For many, addiction starts as a coping mechanism for trauma, such as domestic violence or unemployment, but it often becomes a trap, preventing progress toward stability. For example, Maria, a 32-year-old mother of 2, described how her addiction to heroin escalated after losing her job, eventually leading to her eviction. Substance abuse also strains public resources, with emergency medical services responding to over 500 overdose cases among the homeless population in Salinas last year alone. Comprehensive solutions, including access to detox centers, education programs, and harm reduction initiatives like needle exchange services, are essential for breaking this cycle and helping individuals rebuild their lives. Why homelessness persists. The root causes. Housing affordability. Salinas, like much of California, grapples with an acute housing affordability crisis. Average monthly rents exceed $1,800, with many units requiring higher income levels than local workers can afford. Affordable housing developments remain limited, and long waiting lists make access even more challenging for vulnerable populations. This problem is especially acute for low-income families and individuals working in seasonal agricultural jobs who often earn minimum wage or less, averaging around $15,000 to $20,000 annually. A report by the National Low-Income Housing Coalition highlights that a worker in Salinas needs to earn at least $34 per hour to afford a two-bedroom apartment at fair market rent. The lack of affordable options forces many into overcrowded living conditions, vehicles, or homelessness, perpetuating instability across the community. Economic disparities. Salinas' economy relies heavily on agricultural and service industries, which often provide low wages, limited benefits, and little job security. Seasonal work, a mainstay for many residents, leaves significant gaps in income during off-seasons. According to the U.S. Census Bureau, nearly 18% of Salinas residents live below the poverty line, with an even higher percentage facing financial precarity. A single medical emergency, unexpected car repair, or job loss can push families over the edge into homelessness. The city also has a growing wealth gap, with agricultural executives earning exponentially more than field workers. Efforts to diversify the economy and provide workforce training programs for higher-paying, stable jobs have been limited, leaving many residents with few opportunities to escape the cycle of poverty. Lack of support services. Mental health issues and untreated illnesses are widespread among Salinas' homeless population, exacerbating their vulnerability. Nearly 38% of homeless individuals in the city report suffering from mental health conditions such as anxiety, depression, or PTSD, while 25% cite chronic physical illnesses. However, Salinas lacks sufficient mental health facilities and outreach programs to address these needs. For instance, there are only 2 mental health clinics within city limits that provide free or low-cost services, both of which are overwhelmed with demand. Emergency rooms often become the default care providers, straining resources and offering limited follow-up care. Expanding mental health outreach programs, mobile clinics, and community-based interventions is critical to addressing these gaps and supporting individuals on their path to recovery and stability. Humanizing the issue, Maria's story. During our exploration for world travel, we met Maria, a mother of 2 who has been living in a tent near the Salinas River for over a year. Maria's journey into homelessness began when the pandemic hit, forcing the restaurant where she worked as a waitress to shut down. Without steady income, she quickly fell behind on rent and was eventually evicted from her apartment. Maria now struggles daily to provide for her children while navigating the challenges of life without stable housing. Despite her circumstances, Maria remains hopeful. She dreams of finding steady employment and providing her children with a safe and stable home where they can thrive. Her days are spent juggling visits to local food banks, ensuring her kids stay enrolled in school, and searching for work, often facing rejection due to her current living situation. Maria's story is one of resilience. but it also reflects the systemic failures that trap many in cycles of poverty and homelessness. Our experience highlights broader societal issues: the lack of affordable housing, the fragility of employment in low-wage industries, and the insufficient safety nets for families facing financial crises. Maria's journey challenges us to view homelessness not as a personal failing but as a societal problem that requires collective action. Her story reminds us that every individual experiencing homelessness has a unique narrative filled with hope, struggle, and a desire for a better future. It urges us to rethink our approach, advocate for meaningful reforms, and foster a culture of empathy and support. 6. Exploring solutions. What can be done? The homelessness crisis in Salinas is challenging, but it is far from insurmountable. Cities across the U.S. have implemented innovative and effective strategies that Salinas can adapt to its unique needs. By investing in affordable housing, expanding access to mental health services, and fostering community involvement, Salinas has an opportunity to significantly reduce homelessness and improve quality of life for its most vulnerable residents. Affordable housing initiatives. Increasing the availability of affordable housing is essential to addressing homelessness in Salinas. Programs like Housing First, which prioritizes providing permanent housing before addressing other challenges, have reduced homelessness by over 50% in cities like Houston, Texas. In California, similar initiatives have shown promise, with a state report highlighting a 30% reduction in chronic homelessness among participants. Salinas can benefit from implementing similar programs, coupled with incentives for developers to build affordable housing units. Currently, only 18% of low-income renters in Monterey County have access to affordable housing, underscoring the need for expanded efforts to meet demand and stabilize vulnerable populations. Expanded mental health services. Mobile health units and community-based mental health programs can provide critical support to homeless individuals who often lack access to traditional healthcare facilities. Studies show that cities with robust mental health outreach programs have reduced emergency room visits by 40% and improved engagement in long-term care. In Salinas, where nearly 38% of the homeless population suffers from untreated mental health conditions, investing in mobile clinics and peer support programs could fill a significant gap. Additionally, integrated care models combining mental health services with housing assistance have shown to reduce homelessness by 25% in similar communities, providing a holistic approach to recovery and stability. Community involvement. Local businesses, nonprofits, and residents must unite to create a network of support for the homeless population in Salinas. Volunteer-driven initiatives, such as shelters and food distribution programs, can provide immediate relief. For example, cities with community-sponsored shelters have reported a 20% increase in access to temporary housing. In Salinas, organizations like the Food Bank for Monterey County already provide critical services, delivering over 5 million meals annually, but more collaboration is needed. Expanding partnerships between local stakeholders can amplify these efforts, while raising awareness and fostering empathy within the community, creating a more inclusive and proactive approach to addressing homelessness. Did you know that in some cities, integrating homelessness outreach into public libraries has provided a safe and welcoming space for those in need? Salinas could benefit from similar creative approaches. 7. Broadening the lens, homelessness as a national issue. A shared crisis across cities. Homelessness is a growing national crisis, with over 580,000 people experiencing homelessness in the U.S. annually. Cities like Los Angeles and Seattle struggle with similar challenges, demonstrating that homelessness is not just a local problem but a systemic issue rooted in nationwide inequalities in housing, healthcare, and income distribution. Economic inequality and its role. The widening gap between income and living costs is a significant driver of homelessness. Nationally, nearly 11 million renters spend more than half their income on housing. In agricultural communities like Salinas, seasonal workers face additional instability, as inconsistent wages leave them vulnerable to financial setbacks and the risk of homelessness. Mental health and healthcare deficits. Nationwide, 25% of homeless individuals suffer from untreated mental health conditions, contributing to chronic homelessness. In Salinas, the lack of affordable mental health services worsens the problem. Studies show that integrating healthcare with housing initiatives reduces long-term homelessness by over 30%, highlighting the need for robust mental health programs nationwide. Systemic neglect and policy gaps. Decades of underfunding affordable housing programs and inadequate social policies have worsened the homelessness crisis. Since the 1970s, federal support for affordable housing has dropped by over 50%. Cities like Salinas are left to bridge these gaps with limited resources, underscoring the need for comprehensive federal and state-level intervention. Fostering empathy and action. Beyond policy changes, addressing homelessness requires a collective cultural shift. Empathy and grassroots action can drive meaningful change, as seen in cities where community involvement has expanded access to shelters and support services. In Salinas, fostering partnerships between nonprofits, businesses, and residents is critical to creating a sustainable and compassionate approach to this pressing issue. Call to action. Support local nonprofits. Local organizations in Salinas, such as the Food Bank for Monterey County and Dorothy's Place, are lifelines for those experiencing homelessness. These groups provide essential services, including daily meals, temporary shelters, and job placement assistance. By volunteering your skills, organizing donation drives, or becoming a regular contributor, you can directly impact someone's life. Small actions like sponsoring a meal program or donating hygiene kits can create tangible change for individuals in need and inspire others in the community to join the cause. This travel documentary has aimed to uncover the realities of homelessness in Salinas, shedding light on both the challenges and the opportunities for meaningful change. The stories and solutions highlighted here serve as a call to action for individuals and communities to work together toward creating a future where homelessness is no longer a defining issue. As we conclude this documentary, we encourage you to reflect on the stories shared and consider how you can make a difference. Whether through advocacy, volunteering, or spreading awareness, every action counts. Don't forget to like, comment, and subscribe to our channel for more documentaries that tackle critical social issues and inspire action. Your support enables us to continue sharing impactful narratives and fostering a community committed to positive change. Together, we can help build a Salinas where everyone has a place to call home.